My name is Suhail Essa.
Dr. Nkunqa,
Dr. Brendan Matthews.
Dr. Naseem Sharif.
and this is the Gentleman's Clinic podcast.
Nkunqa, you know what's Nkunqa?
What?
There is poison everywhere.
Gunshot Penis.
What?
You don't know what's Nkunqa?
Aliens are poisoning our water.
The slang for it is called dick cheese. Dick cheese.
You have a small penis.
This is the Gentleman podcast. We must talk about these things. We are a virtual online consultation platform. We cannot cut your penis from a computer screen. Welcome to episode 2 of the Gentleman's Clinic podcast. 6 South African male medical doctors on a mission to change the perception of men's reproductive health. My name is Dr. Suhail Essa, and gathered with me here in the studio is my lovely co-hosts, Dr. Nkunqa Vilagazi, Dr. Brendan Matthews, Dr. Naseem Sharif, and hey, where's Vish? Last time, Brendan, you were late.
Yeah, and you guys gave me hell for it. So now I hope you're going to give Vish hell. And
Yeah.
it's so late that we had to start the podcast without him. But
Yeah.
anyway,
It's fine, man. The man's busy. He's probably saving lives out there or saving
likely.
penises.
he says it's coming.
One or the other. But as you guys can see, we've got a new setup here. We've got a lovely new background. We've got branded scrubs. You guys like the branded scrubs? Looking fresh.
Nice.
On this
Looking nice.
lovely Sunday morning. Today we're going to chat about a couple of interesting topics. I think we've taken some feedback from our audience. People have sent through a couple of suggestions on what we
Yes,
should talk
yeah,
about.
yeah.
And we've also come up with a few new ideas that we'd like to share with you. So we're looking at a great episode, guys. So stay tuned. It's gonna get funny. It's gonna get informative, and most importantly, education. That's what we're here to do.
Exactly, yeah.
So without further ado, let's kick off the episode. Yeah, man. Where is? Hey, Vish. Vish. Oh, there's
Sounds like
Vish.
it's guy,
Vish.
yeah.
Come, man.
Vish. Oh, always late.
Hey, sorry, gents. I was actually just coming from the hospital. Yes, the traffic was hectic as well.
Yeah.
Coming from the
sorry,
hospital.
yeah.
Yeah, it's such key.
No,
stuff.
serious.
No.
Were you in the?
No, genuinely, I was actually just coming from a case. I just finished a theatre case now.
What
Is it?
case?
It's super
That's why you went
Yeah,
answer
it
the
was
phone.
actually a patient I saw in trauma. It was actually an isolated gunshot penis.
What?
Yeah,
Gunshot penis. Wait,
This guy's life is a movie, man.
wait, hold on. Yeah. Did he? Who shot him?
No, so it was actually self-inflicted. The patient actually shot himself. So
Huh?
He shot himself.
Yeah.
Yeah, how dysfunctional does your dignity be?
Wait.
Why?
No, this happened.
Wait. Did he tell you why?
So yeah, the patient did tell me why. Obviously, I mean it's a bit confidential.
Okay, that's fine.
It's a mistake, though.
But yeah, I mean otherwise the surgery was very interesting. Went very well.
Is it?
Yeah.
That's good.
Wait,
Good
how?
work, good
Okay. So in terms of trajectory-wise, what was affected?
So essentially, the patient obviously he cocked his gun. No pun intended. No pun intended.
Yeah.
So essentially, it went through the dorsal aspect of the penis, and there was another wound on the ventral.
So just show us with your hands so that the people can.
Yeah.
So the dorsal aspect. It went through.
So for you guys who don't know, so the dorsal aspect we use anatomically. So if you're looking down, the dorsal aspect is essentially the view of your
the
penis
bottom.
that
Yeah.
you
So
have.
on the hand,
Yeah.
Yes.
the dorsum
So-
of the
so-
penis is.
So from the top here, that's the dorsum, and then the other side is the ventral aspect.
Oh, okay. Okay.
Okay, so anatomically, on the top you have two. Essentially, it's called corpora cavernosum, which functions. Which the function is for the erection.
Yeah.
And then
They're
below
like
that-
sponges, right?
Yes,
Like
exactly.
Sponges for you at home who don't know.
So wait. So how do you repair this? I'm guessing. I mean that it
That's
was
what
probably
I'm
off.
busy
Was not.
thinking.
So it wasn't off, fortunately for
So
him.
it didn't amputate it completely.
No, it didn't. So it basically penetrated the corpora cavernosum, so one of the rods, and then
Sponges.
below that is the corpora spongiosum, which has the urethra, which is essentially the tract in which the urine gets
Yes,
passed out
yeah,
in
yeah.
the male urogenital
And
system.
sperm. Yeah.
Yes.
Yeah.
So
Hosepipe.
The hose pipe.
That was fine, yeah.
Yeah, so essentially you need to, I mean, when you assess these patients, you need to assess for corporal damage, cavernosal damage, as well as urethral damage as well. So this patient actually had both. It was quite tricky, quite tedious operation to do and repair. But fortunately for him, I think it went pretty well.
What do you think? Well, what's the chances of good outcome?
Wait, is he? Well, can he?
Like-
can he pee?
Is he gonna
Can
pee
he
again?
No, so the patient now will have a catheter inside you because he did have a urethral injury. So
Yeah.
we keep that in for at least 2 weeks for the urethra to heal.
Yeah.
Okay, then we will remove the catheter and then we'll do a trial of void to see if the patient is able to empty his bladder adequately, everything is functioning well. Most importantly, the patient is not
Erections.
allowed to have sex for at least 6 weeks.
6 weeks, huh?
6 weeks.
Yeah.
See, that's where penile implants, or just like a secondary.
Wait, will he be able to still have an erection? Do you know?
Yeah, so the injury actually on the corpora cavernosum was not that large. It was about 1.5 centimeters. You know, there are some patients where it's really large, and then their chances of impotence are quite high as well. Just obviously because healing occurs with fibrosis. So essentially, the tissue doesn't return to 100%. Yeah.
So, Vish, you guys need to actually refer that guy and his partner to me. Eh?
Huh?
Yeah. 'Cause
How are you gonna help?
Tell us
He's now
more.
got ED.
I'm telling you, they're not gonna have sex for 6 months, right?
Okay.
6 weeks.
6 weeks.
Oh, 6 weeks.
6 weeks.
6 weeks. But still, what about his partner? Does she understand this? How is she gonna accept it? Is she gonna be understanding?
Well,
Does she know
sure.
everything?
He's
That's
shocked.
it.
Brenda, you're a sex counselor now.
You guys, it's part of what I do, guys.
So
I'm
now,
not a qualified sex counselor, of course, but all of us know about these things. It's
Some type of counseling, yeah.
exactly,
But
you have to.
how would you help this guy or the partner?
No, obviously,
what are
I'm
you
not
gonna just say?
helping.
Just say.
There's nothing I'm gonna do to the penis. There's nothing I'm gonna do to the ladies.
Well, we hope not.
Yeah,
Yeah.
of course.
Yeah.
He's already done everything. What I'm talking about, like the psychological aspect of it. You know, is he gonna be able to communicate well to his partner? Does she understand exactly, you know, the impact of this? Maybe she's actually got like, we don't know. Maybe one of them is hypersexual. I think we're gonna talk about sexual addiction later.
Yeah, we're gonna.
Hypersexuality.
We'll
you
talk
know,
about
and
that
maybe
later,
I'll
yeah.
bring this up
Yeah.
again. But if the partner doesn't understand it and she's not counseled, what if she goes around and gets sex somewhere else? You know,
True,
you
man.
never know. But so she needs to be involved. Do you guys involve the partners in these procedures that you do afterwards?
Vish just
So-
cuts and fixes.
So, Brendan,
We do it.
in our hospital setting, I mean, a lot of the patients we see generally don't come with their partners. As we all know, a lot of these mental health problems are kept private from their partners. I think it is important, obviously, to divulge and share all this information with your partner. So a lot of the topics we discuss, you know, I think may be seen as taboo or
So
you know,
that's
there's a lot of
probably-
stigma associated with it. But I think it's good for men to be able to communicate with their partners who need to also be informed about certain conditions that they
So it's
may need
actually
to be
a
treated
problem.
about.
It's a problem you've picked up, that the issues in your patients, as in general, they not. You find that patients don't discuss them with their
100%.
partners.
100%, yeah.
I think, it's very important that happens. I personally, every pregnant lady that I see, I ask them, how's relationship with your partner? Is it good? Is he treating you well? Are you guys having sex? And they sometimes they look like, Doc, why are you asking me that? I mean, there's some ladies who genuinely don't want to have sex when they're pregnant, right?
Yeah, yeah.
Some that love sex during pregnancy.
I've
Some are
heard of
hypersexual.
Hypersexual, right? But those that don't, do you think there's a man who's going to go 9 months with no sex?
Actually, that's an interesting one.
I mean,
That's an
it's-
But that's actually more common than you actually expect.
It's way more common.
A lot of people have erectile dysfunction, right? And they just end up giving up on having sex. They live sexless marriages. I don't know how you can handle that.
You
But
see,
it is
So
very
now
common.
imagine you're pregnant 9 months. It's related to men going and finding sex elsewhere. And what does that cause? That causes now fighting, because the woman might find out that he's cheating, or he picks up diseases, HIV or other STIs, you know, gonorrhea, chlamydia,
yeah.
trichomonas, and then infects the lady. and it affects the baby, affects the pregnancy.
Yeah.
True.
So it's a very important topic, But yeah, maybe I think we should have a podcast.
Yeah,
Yeah, we should actually-
entire
completely
an
on
entire
that
episode
alone,
on that.
But
yeah,
I'm glad
yeah.
that the man's
He's here to bless us with his wisdom.
Yeah.
the patient is healed, man, to live and fight and rise another day.
Hopefully, guys.
Hopefully, rise another day.
Yeah. No, these chats are important. If you don't have these chats, you'll end up shooting your penis off. Yeah. Any other interesting cases, Vish? Anything else you've dealt with recently that you'd like to share?
Yeah, there have been actually quite a few interesting
No,
cases.
tell us.
I think
We'd
that
like to hear.
there was that one patient you sent to me in the casualty.
Remind me, the one with the.
It was
It is.
youngish. It was a youngish gentleman.
Oh, the guy that tried to take matters into his own hands. Vish will tell you.
What happened?
No, just
Okay.
tell us.
So, no, actually, to be honest, I think first and foremost, we need to obviously, raising all these awarenesses and things about men's health conditions. There also are other medical conditions in which I think patients should just seek professional medical help. For example, this patient X, as we will call him,
Yeah.
essentially he tried to circumcise himself at home with the scissors.
What the hell, huh?
Obviously unsuccessful, no anesthetic, no
Yeah.
Lidocaine.
Like it was.
No, I'm
But
sure there was
why?
anesthesia.
Didn't he have
There's
like
no
a-
way.
No.
At home.
No
The-
anesthetic.
Like no, I
Where
mean,
are you gonna get
alcohol or
anesthetic?
something.
Or maybe didn't he have like
I mean,
a
there's
mental
no
health?
way in your right mind you'd cut your
No,
face.
literally, there was nothing wrong with
Didn't
him.
know mental health
He
disorder.
just was like, and my thinking. So, firstly, you
Wait,
can
wait,
get a
wait, guys.
circumcision at a clinic. You can get it at there are plenty general practitioners that will do a circumcision fairly safely for you. So I don't know
And free.
what. Yeah,
But guys,
and
free.
just emphasize on like, I don't know how to word this, but if this is so shocking to me, imagine to people watching, because I mean, I don't understand. He doesn't have a mental health disorder.
no.
And these things really happen. I mean, we see things.
The guy just. Did he ever like divulge why he like was he so desperate?
So essentially, the patient, again, patient X,
Yeah.
mentions having difficulty urinating. So
Oh,
for those of you who also don't know what circumcision is, Brendan or Cyril, do you guys just want to?
So circumcision basically is the surgical removal of the foreskin on a man.
Okay, and then certain conditions like phimosis.
Yes. You can do it for religious reasons, cultural reasons, and then medical
Some
reasons,
medical
of course. So
conditions,
like
yeah.
phimosis or any other condition of the penis that would require circumcision to improve function or health or care of the penis.
I mean, also, and very prevalent in South Africa is that a lot of men do it because there's quite a lot of data that shows that it prevents HIV transmission.
Yeah.
I stand to be corrected, but I think the last study that I read was like something like 70% less risk,
50%.
50% less risk of transmission. So that's why it's become a lot more popular in South Africa.
Yeah.
We also have to. I think this is a point where we need like a proper graphic in a picture where it shows a circumcised penis and uncircumcised penis. There are too many people
Can you
who
just
have.
throw off?
Yeah. Shush. There's too many people who have phimosis walking around and don't know that they have
Wait, what's
phimosis.
phimosis? Can you explain?
Yeah.
Just explain to us what's
Just explain
phimosis.
this to us.
Okay,
What's
No, so
phimosis?
phimosis is like if the patient's foreskin is so tight that
Yeah.
you can't retract. Some patients is like really like it's so tight that even when they pee, it goes into like it's like a balloon almost.
Yeah, no, I've seen.
So wait,
I've seen
please.
those, eh?
You're
It's
saying that there's
crazy.
people walking around with phimosis, they don't even know they have
And
But
phimosis.
they
what do
only-
they do?
Like
How
the
do they
thing is,
urinate? How do they?
they only realize they have phimosis when they come as a paraphimosis. When
Yeah.
that foreskin now gets stuck
It's unable.
on the
No. So paraphimosis is now if it's retracted,
Yes.
but it can't go back.
go
it can't go
over.
back. And then
Phimosis
as
is
in,
like if it can't even like get
Yeah.
pulled over.
but the thing is,
Wait,
they've
sorry,
had this
repeat that
whole
again?
time.
Phimosis is like when it can't even retract over.
And then paraphimosis is when.
Say it retracts, but you can't now retract it back because it's originally been so tight. But somehow, like obviously, say the guy like pulls it over, the glands become swollen, or edematous,
Yeah.
obviously if it's been left there for a long time,
long time,
or there's any infection and induration and things like that.
Yeah.
So induration is just any inflammation.
So basically, these are disorders of a penis with a foreskin that either can't come down or can't go back up. So you're saying you guys walking around with foreskins that they can't pull back or they
Yes.
can't. I think that's true.
A lot.
I
now-
think that's true.
Yeah, my question is, I mean, obviously the paraphimosis it makes sense. I mean, it's stuck there. The glance is swollen. It's you can see it. This is not normal. But when you can't retract it, is that really a problem? If your foreskin, I mean, if like you're saying it balloons, does that now increase your chances of infection? Is that really a problem?
Of course.
How is it a problem?
Wait,
When
hygiene,
you
like
urinate,
poor
so
hygiene,
like when you imagine
How's it poor hygiene
so okay
if it's
for,
a foreskin?
for
You
the
can
people
never put it
who
down.
maybe are having a difficulty visualizing this,
We have to
you
have
have
a
a
graphic.
penis,
Yeah.
the foreskin is completely like
Covered.
covered
Yes.
over the even the urethra, the
Yes,
hole where your
yeah.
pee comes out. Now if this foreskin is so tight and it's covering the hole, when you pee, what's going to happen? The foreskin is just going to inflate like this with urine.
Yeah. But
Wait,
what I'm saying is
wait.
that I'm sure it's not a complete
Now listen,
closure. It's usually
let
like
me
a
talk.
partial.
It could be like a
Closure.
pinhole, like
yeah,
the-
like
a pinhole,
tiny,
right?
Like yeah.
Nhlanhla, do you know what's Nkunqa?
What?
What's Nkunqa?
Guys, you don't know what's Nkunqa?
No.
Nkunqa is the
Nkunqa.
yeah.
Nkunqa. Is this a
Nkunqa.
Xhosa word?
Yes, it's a Xhosa word. Nkunqa, we always tease kids at school who are not yet circumcised. You know,
Yeah.
Xhosas, they get
When?
circumcised by later, yeah.
Yeah.
Nkunqa is when you pull the foreskin back and there's white sediment.
Yes.
And have you
yes,
seen
yes,
the white
yes,
sediment?
Yes,
Can
yeah.
explain what
Yeah.
it is.
Yes.
Okay.
Right.
That-
That's
That white sediment, the slang for it is called dick cheese.
Dick
right? Dick cheese.
I like you.
That's a slang.
Podcast. We must talk about
Okay,
these.
I like
it's
dick
actually
cheese.
it's actually dead cells. It's actually dead skin cells. That's what it
okay.
actually
No,
is. It's
that-
not
that-
people like a lot. I see it common with kids. So
Yeah, yeah.
kids have phimosis, and then the mom will come with the kid and say, "There's pus coming from my
Exactly.
child's
Yeah,
penis." Then you say, "Okay, let's look," and you see it's a phimosis.
It's cheese.
Now
It's
tell
actually
me, now tell me the dick
It's that
cheese, right?
Nkunqa.
With
dead
the,
skin cells.
with the dick cheese or the Nkunqa,
Yeah.
does
Say
that
the
not
scientific
promote an environment for infection? Like
But the dead
HIV,
cells, does
like
it?
HIV.
That's actually
Well,
that's
like
actually my
myelinitis.
question.
What is
You
the
understand?
proper term?
Rich,
for it?
tell us. Does it
What's dick
increase
cheese
your
and
risk of
Nkunqa? What
infection?
is the medical?
I'm not sure why Nkunqa is.
So that white does it,
That white
so having a
sediment, right?
phimosis, does it increase your chances of urinary tract infections or
Local infection,
or local
balanitis.
infections?
So as
Balanitis,
Brendan is
yeah.
saying, balanitis. So
Yeah.
obviously, if it's a phimosis where basically the lumen, which is the hole in the foreskin, if obviously it's not able or patient's not able to urinate completely, or they struggle or they are forcing the urine out, they may be at higher risk obviously for infection, because also some urine gets retained in that area, which can predispose the person or patient to have further urinary tract infections.
Okay.
No, this is a
Or-
very
or
interesting-
balanitis, as
This
you
is a very interesting topic, and I want to still push on a little bit more about specifically
Because-
about foreskin and about,
Yeah, because there's
this is
debate,
something that's
yeah.
very prevalent that I'm sure a lot of men discuss.
Yeah.
It's a big
Yeah,
decision.
yes.
We
Why
don't
mention it?
we
Just
don't
say
offer
Jesus.
we don't offer.
Oh, sorry, smegma. That's what it's called, the medical term.
Oh, is that the medical term?
Smegma.
Yeah, because we didn't give a
Yes.
medical term. We're just talking Nkunqa.
Smegma. So there's a debate
Cheese.
between whether circumcising and not circumcising, which one's better. So I think, let's.
Yeah, I want to push on that. Now, first, a big disclaimer: we don't treat any of these conditions at the Gents Clinic. Remember, we're a virtual online consultation platform.
Yeah.
We cannot cut your penis from a computer screen. so please, if
Joe,
you need
robotic
that,
surgery.
if you need that, you can come to us and we'll refer you to the right people. But don't think that we can help you immediately on the same day. So if you're having an emergency, please go to an emergency department
Yeah,
or
it's important.
see a urologist, a specialist that can help you with that issue. But I want to push on this topic, and I want to ask, obviously, at this table, my baby, but
I'm
controversial, but who
circumcised.
is-
I'm circumcised.
Okay, I was gonna
I
ask
knew
you,
what you were
you-
going to say.
Yeah. So, look, I'm circumcised. You circumcised? You circumcised? You circumcised?
I'm circumcised.
Okay, all five, boy. Yo, now we can't even have a debate here. What's better or what's
better
worse?
there?
Okay, wait. But I think the easier one.
I rate my
to
boys.
try and separate.
The men from the boys.
Yeah, the whole gents clinic is so concerned. So I think to delineate the debate here, maybe we should find out, okay, at what age? So I was 7 days old. Nasim?
I don't know what. But
Okay, you're probably around about that time,
Yeah.
right? Because as Muslims, we do it straight after birth.
Oh,
It's,
okay.
our culture.
Yeah.
It's a ritual. We must be circumcised within the first week of life. And part of that ritual custom, we also slaughter straight up. So you slaughter your penis, you slaughter a goat. Both
Okay.
must, yeah. Go.
Slaughtering.
Yeah, everything gets
Sure.
slaughtered.
Festival.
So I don't remember
Chops.
the pain. I don't remember what it was ever like to have a
Yeah,
foreskin.
yeah.
On day 7 of life, I was chilling. And my whole life I've been circumcised. So I have no other experience of
A
that.
reference point, yeah.
Now, you, Brendan, when were you
So,
circumcised?
so you basically have umgidi when you were 7 days old.
What?
Celebration.
Wow,
A celebration.
Where are you getting all these terms, bro?
I'm closer.
Okay. So what is umgidi?
Umgidi is the celebration that
Yeah.
Okay.
Umgidi is a celebration that Xhosa boys, when they become men and they come out of the bush from circumcision, slaughter goat.
Yeah, so that's what we do.
Yes.
7 days old.
Ours is
Umgidi.
called akika.
Really? Oh,
Yeah,
okay.
that's our.
That's key,
It's
man.
7 days.
Yeah, 7 days.
Yeah.
7 days
But
old,
I think
man.
it's a good time. It's good, like you say.
Yeah,
no
no, I was
trauma,
never
you don't really
traumatized. I don't know
child
this.
abuse.
I don't know. I didn't have to
Yeah,
look a
that's
man
probably
in
the
his
best time,
eye while he held
So-
it and
so-
just went.
Yeah. So I did it when I was in high school. I think I was 15, 16. Yeah, so I remember everything. I remember, the whole experience.
And
And it was, I did it medically.
proper
right?
medically.
Yeah.
You went.
So,
there was no
um,
mountain.
Yeah, but
There was
but
no
I still
white face
remember-
of paint.
I'm
There
telling
was no
you,
Makweta.
blanket.
there was nothing. There was no bush stuff.
You're not Mkweta.
Yeah,
Now-
no, I wasn't quit. Yeah.
Can I ask what at that time? What was the discussion at home? What was your motivation behind doing it?
No, I think for me it wasn't even a discussion. It wasn't like a cultural thing. It was more of just a campaign and my parents saying, it reduces your risk of sexually transmitted infections and HIV.
Uh-huh.
So that's where my family came from. Because in Zulu culture, it's not
done.
a thing. Yeah. It's really not a thing. So
Brendan,
yeah.
you?
So I was 2 years old, 3. The only recollection I have of it is that in pictures. They're like,
Here's you bathing at
Yeah.
age 1. Here's you at 4. How?
exactly like that. There's a picture. I
happened?
mean, all of us have it. Me, my brothers, family, wherever. There's always that picture where you're standing with a bandage around your D. I mean, as a
Wait,
kid.
but why did your parents decide at 2 years old?
No, I'm not sure. Like my younger brother done it at like 12. So, and then my other brother, he was also like 3 years old.
Yeah.
So I think it was just, that we want our children to have it, and it's cleanliness. That's the belief, There's also the other side that say, no, it's not necessarily clean. You can look after your foreskin. But it's more like tradition,
So it was
in the
actually
family.
tradition for you in your family.
Just in the family, yeah.
So
that
not
everyone is
like
circumcised.
specifically culture or religious rooting
No,
or anything like
I
that.
mean, there is a bit of religious to it as well, but it's not a major thing, because Jews do it also by day 6 or day 7.
Yeah. Some of the
And I mean, if you read the Bible, which we subscribe to, that's where it's also stated that. So, I mean, the Bible also talks about being circumcised. So it's not that we really religious, but there's also that thing in the back of the mind that it's sort of like promoted in the Bible. So it's like something that also influences the decision.
Now, lastly, Vish, you, how old are you?
Don't really have like recollection
So
either. So,
they are-
probably
Any cultural, religious? No.
No, I suppose could have probably been like medical.
Oh, okay.
Yeah.
Medical reason.
But now, are there? You probably know best. But like, are there? Without any medical issue, are there? What are the benefits of circumcision versus none?
I can't think off the bat now.
so I
Okay, nothing.
I was
Nothing
on
like
a,
what?
so I was on a radio station, not a well-known radio station, about 5 years ago, talking about this topic actually, and
Yeah.
there's pros and there's cons. There's people who argue on the side of you must get circumcised, and there's people who argue on the side of like, no, you know. And the big topic that always comes up is sexual performance or sexual feeling. Because I'm sure, haven't you all seen that like, there's people now who are suing their parents, or a few years ago, people were suing their parents
In the US.
in the US for circumcising them, you know, and they were claiming that because they circumcised, their sexual experience is not as pleasurable as it would have been if they weren't circumcised.
Oh, really? Is that a...
Yeah, but there was 5
But like, is this a really proven,
It must have been
scientifically backed
Yeah.
data?
So 5 years ago, I didn't find data that said there's any difference in sexual pleasurability or, you know, enjoyment or sexual experience, whether you're circumcised or not. And then you get anecdotal evidence. So this is people that you talk to. So being from Eastern Cape, a lot of bras would say, yo, when I come out of the bush, I'm jizzing like in 30 seconds. So, so apparently it's more sensitive.
So yeah, it doesn't make sense.
You know, they say that it's more sensitive. Like when
Also,
they
then
just
your
get,
performance is
they
not
get
as good.
premature ejaculation until they get used to the sensitivity. You understand? So
I
that's what they would
see.
say. And then there was also like people I knew with foreskin.
Yeah.
And they would say like the foreskin moves back and forth as you're thrusting.
Yes,
And
yeah.
that's more pleasurable for them. And now us with no foreskin, there's no back and forth. But I'm saying no, there's back and forth there inside. You know? So
Yeah,
I'm not sure
yeah,
there's a debate around this. And then there's also the debate that says it's abnormal because you're cutting something that's naturally there. There's surgical risk to it. You know, and then the way a penis looks, it's dry. Your foreskin is dry when you circumcise. I mean, not your glans, penis. The head of your penis is dry when you're circumcised, which is not natural. It's natural for it to be moist with the foreskin on it. You understand?
But then also, and that's why the debate comes in about, you know, sexually transmitted infections.
Yes.
And
Yeah.
because it also acts as a lovely environment for bacteria to
Yeah.
just sit and grow and
And
replicate.
you always need to look at what's the benefit versus the risk. And I think why South Africa as a government pushes towards saying everyone should be circumcised is because in general, there's a very, very large, a lot of poverty in South Africa. Low socioeconomic standard, poor access to water, hygiene is very low.
Yeah.
And so hygiene is going to be low. We know we're a very promiscuous country. High levels of sexually transmitted infections. The highest number of people living with HIV in the world per country is in South Africa.
Yeah,
So
100%.
when you have all of those aspects clumped into one, it will logically make you move over to the safer side and say, let's circumcise everyone.
So it's more of a public health
Yes.
initiative more than
And then I can even play devil's advocate and go against that as well.
yeah.
To say that, but let's not,
yeah.
Yeah, let's not. I think we better.
It doesn't prevent like you from getting.
Yeah. No, people need to know this, that it doesn't actually prevent HIV.
You still
Yeah.
One
Please,
hundred
people
percent.
mustn't think now you can just cut your foreskin and,
and then
and
you're
go
free.
run wild.
No ways, no
Yeah,
ways.
no, it does. It definitely
sure.
doesn't do that. But I think I think we've chatted enough about circumcision.
Yeah.
And we'd like to introduce a new segment to our podcast where we actually break down some of the most recent research on men's reproductive health. So,
Sorry,
for this segment,
can I just ask something?
yeah.
I haven't slept well, and these lights are burning my eyes. I'm going to ask if I can just put on sunglasses.
yeah, sure, why not?
Because I keep blinking as well.
Okay, that's wow.
This
All right.
it helps, man.
Okay,
light
and on
there.
that note, Dr. Brendan Matthews, why don't you tell us about your first study that you found for our podcast episode today?
Yes. So yeah, I actually like this segment that we've introduced now, where we're going to come with new research or new exciting studies that are perhaps not out there in the public yet.
Cool.
So I actually have two.
Yeah.
And the first one is actually the causes or the clinical picture that young men have. So young men with erectile dysfunction. So, as we discussed in our first podcast, that erectile dysfunction impacts largely men over the age of 40. But increasingly, over the past 10 years, doctors around the world have been seeing men with erectile dysfunction under the age of 40, specifically age 19 to 35.
As young as 19.
As young as 19.
Wow.
Yeah.
What's happening?
So that's the question. What's actually
And what is
happening?
the study? How did the
So-
study try to prove or disprove that?
So not really to disprove, but really to find out what is driving the erectile dysfunction
Issue.
in these young men. Yeah. So what was sort of expected is that none of these young men, so they looked at from age 19, they didn't have actual heart problems, cholesterol problems. Smoking was prevalent, but it wasn't statistically significant as a causation to the erectile dysfunction. But what they found that is that there was a lot of psychological aspects to it. A lot of psychological aspects, and basically the way that you can clinically differentiate between whether erectile dysfunction is psychological or it's caused by nerves or failure in the cardiovascular system is whether or not you rise in the morning, rise with the sun, as you said.
Yeah.
So morning
So we're onto
erections,
something. Yeah.
or nighttime erections, right? So they were finding that these young men were all having nighttime erections. They were all having morning erections. So clearly their body's functioning fine.
Yeah.
So it was
But,
psychological.
Yeah, but
But I mean, that's still, I don't know if that's strong enough evidence just to prove that theory.
well, obviously,
What
What's the study
parameters did
design,
they
yeah?
like use? Like, what's the study design?
so basically they took a whole bunch of young men in certain medical practices that had presented with erectile dysfunction,
Yeah.
and looked at all the parameters: high blood pressure. They looked at cholesterol levels, smoking, obesity, and heart function, and so forth. And so that all these young men have no problems in this field until they dwelled into the psychological aspects. So what they found is that young men tend to have young men in monogamous relationships tend to suffer more from depression, anxiety, or interrelationship issues more than older men. So it makes sense when I thought about it is that our timers in their 50s, 60s have been with mom for years, man. They understand this lady understands this man. They know how each of them act, and they've grown into each other over all the years, right? So they're performing fine, if they don't have sexual issues. In terms of psychologically, they are more fine. They understand this woman. This woman gives me issues when I come home late. She complains. I know I just need to keep quiet, and I will be fine in the next morning. But young men have an issue because they're still learning this partner of theirs. You understand? So wait, the study didn't say this. This is me now thinking.
Okay, but what is the theory that the study is proposing?
The study is that it's
Because you
psychogenic.
spoke about monogamous and
Yes, it
being
spoke
in a
about
monogamous
monogamous relationship and interrelationship problem.
Yeah.
So I am now giving my understanding of what these relationship problems could be. This is what we can talk about.
Yeah.
And my first theory is that young men are still understanding their partners. So young man comes back late from groove. Woman is waiting there at home, sitting there pissed, and he doesn't know how to respond to this. Now there's arguments, or he's accused, and there's these other type of
Okay.
interactions that I believe reach these depression and so
No,
on.
okay, hold on.
Yeah.
Here's where, for me, it gets a bit confusing. Why now is it becoming more prevalent? Because let me tell you something. Your father also used to come back from groove
Exactly.
when he was 30 and had
He
to
was
deal
also
with that
learning,
problem.
yeah.
So why is it now in our current society? Why are we having younger men that are suffering from?
I guess there's different ways to look into this. It could be the fact that, there's someone who's just taken an interest in this, and there's now, a lot of
Picking it
research
up.
around it, and you find that it's always been there. Or it could be the fact that, one time, actually, when was it? Like a couple of weeks ago, I was talking to Ness, and he was telling me about the fact that we're being pumped with, phytogens and estrogen.
Yeah.
Yes, you want to tell me more about the that conversation.
I think we did speak
estrogen.
about it a
did
little bit
speak
on the
about
last
that, yeah.
podcast, but
But
I think we can
liked-
delve a bit
I
deeper
liked
into
the because they didn't just end there. They actually looked at how these young men responded to treatment, right? So they gave the men the normal treatment for erectile dysfunction, your Viagra, Dynafil, Cialis, and so
They
forth.
gave the 19-year-olds.
Yes, this
sure.
group of that
Okay.
there were studies, not only 19-year-olds, it was up to
Up to 35,
35, yeah. And they found that the men who were in monogamous relationships, so a guy who was with one partner, responded poorly to the treatment than a man who was just running around as a loose molecule with different. basically-
so the group that responded were the polygamous group.
So
They
the
were
the group that responded the best to the medication were those who did not have only one partner.
So in conclusion,
I'm
what
not
Brendan
concluding,
Matthews is
no.
saying
Trying to say.
is if you have erectile dysfunction, become polygamous.
No,
That is a cure for erectile
right.
dysfunction. You heard it here first.
no.
Have more
Guys,
than one partner and it'll go away.
That's not
Quick
what I'm
fix.
saying, but that's what that study found, and they do say that obviously more studies need to be done. But I can explain why that might be the case.
Okay,
You know,
you can
anecdotally,
explain.
anecdotally. I mean, it's
Anecdotally, okay.
not me personally, from what you see on the street.
Yeah.
Because I've never had erectile dysfunction, guys. I don't know about you guys, but
Okay.
I've never cried of that
Okay.
thing.
Brendan,
Yeah.
did they also look at hypogonadism
No,
as causes?
no, they didn't mention that specifically, but they looked at medical causes, but they didn't look at
Hypogonadism, you want to
Guys,
touch on
Ness
it
was about to
quickly?
tell us about estrogen and phytogen.
Okay.
And, yeah.
Guys, it feels like everything reduces testosterone in this world right now. Right? It is crazy.
Everything.
It is
Yo,
insane.
feels like
Everything.
everything.
It is
Look
insane.
directly into the camera and
Guys,
say that again.
There is poison everywhere. There is honestly poison everywhere.
Now it feels like we're going into this conspiracy theory podcast.
Conspiracy theory.
The aliens
Okay,
are
but
poisoning
here's
our
what the studies
water.
are saying, right?
Yeah.
So testosterone levels are were decreasing by 1%. Average testosterone in all men are decreasing by 1% every year.
Yeah, you said this in
Right?
the last podcast.
But that's
Okay.
natural.
Tell us something
progression.
new now, Ness.
And it's even accelerating to 3%, right?
Okay.
Let's talk about what they think it was, right? So there's phytoestrogens, right? So a lot of protein are coming from soy, right? So
Yeah.
from these plant products.
Yeah.
Phytoestrogens reduce testosterone, right? There's endocrine disrupting chemicals and like things like atrazine and all these kind of pesticides, right? So if your vegetables and fruit were sprayed with pesticides, you could have some of that residue that still remains on it. And if you eat it, I think there was a study like I heard from this guy, what's this guy running for president?
Kennedy.
Yeah, Robert Kennedy mentioned
Robert
it,
Kennedy,
right?
yeah.
There's a study that they had frogs, right? Male frogs, and they exposed them to atrazine, right? These male frogs turned into female frogs after
Oh yeah,
exposure to
yeah.
atrazine.
I saw that.
What?
Yeah.
Ew.
So not all
Wait,
of
wait,
them.
what's atrazine again? Just
Atrazine is a pesticide.
So some of the
Yeah.
frogs
Yeah.
developed the ability to get female eggs. So they developed female reproductive system eggs,
Yo.
and some became female.
Yeah.
I was like, "What is this, man?"
So
I
those
wanna see that study.
are
yeah,
so
we must
it's-
make sure we pull up the studies and
But guys, also
And
need
just
to,
show it, yeah.
we also need to be careful of studies, eh? But anyway, finish.
right. So endocrine disrupting chemicals, right? So try if you want to avoid them, try and get as much organic things. So like there are some organic food have like limitations of what pesticide they can use, right? So if they try to be as obviously it's very hard to avoid it, right? So it's almost impossible to get like proper pesticide free, but they do have limits. So try to get organic food, right? Then there's phytoestrogens. Try to stay away from them. All these soy products. Then there's xenoestrogens. So xenoestrogens are chemicals, right? That are like in plastics, right? And the thing is, back in the day, you used to get a Coke can. Coke used to come in glass, right?
Yeah.
Everything used to come in glass.
Yeah.
Everything was glass. Now it's all plastic. Everything's plastic. That's what I think. That's what I think has. And all this right now is being all this plastic
and there you are just
is being
drinking
leaked
it,
into
huh?
it. Exactly.
I think
Putting
just
that poison
for
in your body.
And people are saying now you're going to see a lot of BPA free stuff. So try and get as much as possible BPA free
I think there must be.
I have seen it. I have seen some of the
BPA free.
BPA free
It's on
plastic
what is it?
bottles.
What is
They do have
BPA?
that.
I
told me.
opt now. Ever since Nas told me that, I opt now.
plastic.
I've got glass bottles in my
That's
fridge,
key.
Is
and
it?
I drink water out of only glass
That's
bottles
key.
because I used to drink a lot of. Out of
But-
plastic.
but
even
And
the
actually
water that you
and
drink, even the water that you
the
drink.
taste is different.
Yeah.
I don't know if
Look, even
know
the
if
water
you
that you
guys
drink.
noticed
So there's people who say, I haven't found a proper study on it, right? But they say that, like, the water that you drink from tap water has a lot of estrogen in it. So let's say women would drink oral contraceptive pills, right? They'd piss it out in the water. It'll go into the water system, right? And then you'd now drink it. So
I am
I'm
sure
not.
Nas-
I'm not.
sure.
So listen,
that is kinda- I'm not
sure.
Yo, wow.
Yeah,
what
what
next? You're gonna
you-
tell us the
guys-
Illuminati wants to get us about this?
we have to be. I mean,
Personally-
studies, anyone can do a study,
Yeah.
right? You
Yeah.
can take a group of us here.
That's
now
why I'm also saying
and
that I
make
haven't found a study on it. But
Okay.
I
but
mean,
I think it's
yeah.
safe. I think it's just get as much cleaner water as you can.
Do you
Even
know-
tap water has fluoride anyway, so
Yeah.
it's not good for your brain.
Yeah,
anyway.
no tap water.
True.
I mean, I saw a study that said they realized that women who take crystal meth, so tik, women who take tik have more vaginal lubrication. So what they've done is they took a whole lot of rats
that?
and made the rats, they anesthetized the rats. So they knocked the rats out and then they tested the vaginal lubrication of the rats with sticks with cotton on, and then gave them tik, gave the rats tik, and the lubrication was
No,
out of
we are
order,
not
man.
promoting any taking of.
Okay, but
that's
but
what
think
I'm
about
saying.
wait, but think about how that would work. Think about how that would work.
sexual
Though.
function.
So look,
Please.
No, but you
don't.
said
but think about how it works. It's a stimulant, right?
yes,
Yeah.
nitric
So
oxide.
during intercourse, there's a SNS response that causes the erection, that causes the erectile tissue to stimulate, right?
And
so you give a
similarly-
stimulant, like even if I take methylphenidate or whatever it is, those kind
It's
of
the same like
Ritalin.
cocaine
Yeah,
causing
yeah.
pregnancy.
Ritalin
yeah,
can
yeah.
improve your sexual function, right?
True.
But we don't obviously going to use that. But like
Yeah.
I'm saying that if
No,
you think
we-
about how
we,
it could
we need to
work,
talk about real legit studies,
No,
and that's
that's
why
what
I'm
I'm
moving
saying.
on to Clark.
We need to be
give
careful,
us
yeah.
to give us an interesting study that he found. Tell us what you found.
Very,
Clark.
very, 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 very interesting study. It's actually a novel study, which means it's something new, something
new.
someone is trying to see if it will work. And so what these guys have done
So it's
is that-
experimental.
yeah,
Yeah.
really experimental, something that hasn't really been done or anywhere. It's just in
Yeah.
labs. But I just found it really, really interesting because it combines so many things that Vish probably learns about or have been done before. So things like PRP, plasma rich protein. I don't know if you guys use any of that stuff, but plasma rich protein.
Oh,
Yeah, so
penile-
for hair we use the
Yeah,
PRP.
Yeah.
The PRP injections into the
Yeah.
scalp
but for
to promote blood.
I'm not talking about protein-rich plasma.
what did I say again?
Yeah, no. but
No,
I
no, no,
think it's-
platelet rich plasma.
Platelet
Okay.
Oh,
plasma.
platelet-rich
Platelet.
plasma.
I said platelet rich plasma. I didn't say protein rich plasma. Hey? I
Plate-
don't
no,
know.
Platelet rich.
Platelet rich.
You, I think what you mean is
Gents,
platelet
let's
rich plasma.
No,
try
they-
on.
we
But
need to
actually,
say
just
that
tell
we-
us about the study. Please tell us about the study.
Okay.
So that we have an idea.
So the study looks at combination treatment. So PRP, which is platelet-rich plasma, it looks at to enhance obviously penile length as well as girth.
So this is now you want to increase the length.
The length, girth.
So length
in
is
sexual
this way,
performance.
girth is that
Exactly,
way.
yeah. So how they do that is using this PRP, using vacuum for erection. So this is now trying to pump the smooth muscle and obviously giving yourself the girth, and using things like penile traction for length.
Penile traction.
Traction. So
How
you
do
see,
they do
you see
that?
how girls in the gym wear those weights. You know how when they do body exercises.
Weights
We're like
on your
ankle
body.
weights.
Have you ever
Yes,
seen
ankle weights,
women
ankle
wear
weights,
Oh,
ankle
yes,
weights.
yes,
Yeah. So imagine having something like that walking around.
On your penis, a weight
A
to
weight,
pull it
a
down.
weight, exactly. Yeah.
Damn, but don't
They
they
didn't
just make
specify.
the...
They didn't specify how much weight. I'm sure it's not that much
Yeah,
weight.
of course. I mean, you can't have like a 5 kg dumbbell. Just
Exactly. Yeah. And funny enough, this study actually found that this didn't only increase the length, girth, but things like sexual satisfaction for the partner, There's improvement of performance, and I mean the results were
Is the-
were
So the
achieved.
traction, the platelet-rich plasma, and
Yeah,
what else?
the vacuum,
Yeah,
the penile
vacuum.
vacuum, and we spoke about the weights, right?
Was the erection maintained? Like the firmness of the erection?
So there's improved length, girth, and length of erection. So that's why I was saying performance.
But
Performance was improved.
just the hardness.
Yes, the hardness.
It's-
Because don't
oh,
forget
okay.
there's vacuum as well.
I
So
I actually had that. I thought that vacuum would decrease the firmness of the erection. So it's actually the opposite. It's the other way around, according to the study.
Yeah.
that-
So according to the study, it actually increases the firmness
Oh, okay.
When you use a vacuum.
when you use vacuum.
But with the platelet-rich plasma.
Exactly.
And wait, how
Yeah,
does this
not at
vacuum
all.
sit on the penis now?
So the thing about this, like I said, it's a novel study. You know, they don't explain quite a lot. They don't. So
But
they,
are they actually doing this? Have they taken a group of men?
yeah, it's a very small sample size. They used 16 people
Okay.
to do it.
And they wanna see if
but
it
I found it
actually
really
makes-
interesting. Like
Yeah,
to think
yeah,
that
to
someone,
increase your
I mean, someone took a
penile growth.
combination of
But I
these.
mean, we must mention
So
that we don't
does-
currently do any of that here at the
Yeah,
church.
yeah.
Just on this study, the participants that they have included in their study, so has there been certain criteria,
So yeah. So the big
penile
criteria.
length or girth, or what have you found on it?
No. So the only thing they mentioned about the study was that it had to be healthy men, right? So if you had any previous, penile problems or sexual transmitted infections, you were cut off the study. So it had to be healthy men, and according to them, they defined healthy men. I need to look this up.
Which healthy men are. But I like that we're making advances, man.
But
Because
vacuum and traction are not new. Those are old ones. But the new one is using PRP with
the
all of it.
PRP, right?
Yeah.
And I think
So
there's
do they inject it into the corpora or what?
there's
They
also
actually don't
there's
speak
also,
about,
nitric oxide tablets
how they.
which they also use
Okay,
for
yeah.
this type of thing.
So modified P-shots were administered in the right and left corpora under ultrasound guidance once a month for 6 months, using pure spin, double spin, okay, whatever.
Yeah, you need to say it loudly so that we can yeah.
Okay. All right. So basically, the new addition to what these guys did was that they added PRP to the already existing stuff. So the penile erection, the penile vacuum, so erection vacuum, as well as another thing that I didn't mention is nitric oxide precursors. So your supplements, basically,
So they
and,
put pre-workout in.
so the pre-work ashwagandhas and etc.
Oh, okay.
Yeah. So how they did it is that they injected, I think it's once every 6 months. They injected the penis, obviously in a certain location, and then these patients were followed up and
Don't try this at home.
Yes. But I think over a year they were able to, so they then gave them 6 months, and they checked to see what had happened. So how they were actually following these patients up is that they had to take pictures of their current size and length, the current length and girth, and then this was compared to what the results were,
the results were.
after.
So there were good results, eh?
Very good results. Very good
Okay,
results.
okay.
Yeah, no, don't try this at home.
And I
But a
think,
lot is being done out there.
A lot is being done because I think men are also. I mean, there's a lot of pressure, especially on social media, and there's a lot of porn intake as well. And people they think that what they see on the screen is normal, but normal penis size is not what you see there
Yeah.
on porn or in movies or whatever. I mean,
Are we gonna touch
because that's
on
what
that?
average penis size. So I mean, it touches me a bit because people explore funny things. I mean, I'm sure, if people can be putting peanuts in their penises for to enhance their sexual function, I'm sure there's guys walking around with homemade weights hanging.
Yeah, yeah,
I'm telling you.
Homemade weights.
I'm telling you, they're walking around with weights. But anyway, I'm gonna give.
Yeah, you need to give us your next study.
Yeah, I'm gonna give ladies the plug now on
Tell
how
us.
to actually identify if a lady out there is looking for a man with a manly man or a man with if they can use something to assess penis size. There's actually a bit of science that can help us see what is penis size, what is testosterone levels. So if you look at your fingers, right?
Yeah.
development of fingers in the womb. So when a boy is growing in his mother's womb, the development of the penis and
Yeah.
its length and how long the fingers are androgen dependent. So they're basically dependent on testosterone. Right?
Aha.
You understand? So
Yeah.
guys, look at all your fingers. Put your fingers up, because now I'm gonna expose you.
Yes, Nas, you too.
Put your
You
fingers
too.
up.
Don't think that just because you're from Ethiopia, you exclude yourself.
So look at your second finger, so your index finger,
Yeah.
Index.
and look at your ring finger.
Okay.
Yeah.
If you listen carefully,
Okay.
Yeah. Yeah.
if your index finger, I'm gonna put it the other way, if your index finger is longer than your ring finger,
Yeah.
you have low testosterone and you have a small penis.
Yes. Finally, come on. I want this
Index
one.
finger
If your index finger
What
is
if they're the
shorter
same?
than your...
No, if it's longer,
it's
or
longer,
the
yeah.
same size. Mine is shorter.
Longer.
Mine
Mine
is
is
also shorter.
So basically, your ring
Mine
finger,
shorter.
your ring finger needs to be longer than your index
Yes,
finger.
that's me.
Yeah.
Look,
So we're doing well. We're doing
What
well.
if they're
on.
the same
Wait,
same length?
Brendan, is this
try.
even? Is there any
even
evidence?
legit?
Is this even? What are we doing?
Listen, I'm
Yeah.
gonna explain to you, Ness. You child.
That's not true.
What rubbish
Yes.
is
Yes.
this? Rubbish.
Okay, so
Tell me how they
Yes.
identify. Where? So is this just
so
a
listen,
hypothesis?
So listen, there's obviously a physiological scientific basis to the thinking, right?
I don't believe
But
that. And I'll tell you
no,
why.
listen
Yeah?
to me. The basis of it is that the growth and the ratio is androgen is testosterone dependent. Right?
Uh-huh.
But whether this relates to penis size, that's what's being studied, right? So they've been actually looking at this since about 2003. Preliminary studies, or these small studies that they've made, there's no high level studies yet.
Yeah.
But they're finding that if your index finger is the same size or longer than your ring finger, you have lower testosterone and you have a smaller penis.
What rubbish.
And I'm sure women is at the forefront of the study. It has to be. It has to be.
Nonsense.
You know, this
So-
reminds me
Or
of.
can you
Let them-
circumcise your
let them
fingers?
check it
There's-
properly.
Yeah.
You understand?
Circumcise your fingers. You say that.
So, I mean,
Also, the testosterone that you have in utero is going to be different to what your endogenous testosterone that you
gonna be
produce
as you
during
grow,
puberty
yeah.
that also contributes to all of these things.
don't your fingers also grow during puberty? Or they like this when you born?
Yeah, they grow throughout your life, man.
They like
until-
that when they're born.
Exactly.
Yeah. You just have babies' hands.
So that's actually coming to what you're saying, is that
Yeah.
it's your length of your penis is testosterone dependent.
But also growth hormone dependent, so it's different.
So guys, just
So there's
look
a lot
at
of
it.
factors. Yeah.
There's a
There's
lot,
a lot of
factors.
factors.
Can I
So
just?
don't come with this nonsense, guys. Don't look at your hands now and go,
I think.
my life
Oh
is
my
over.
gosh.
But
Oh
you
my gosh,
see
everyone's
that-
gonna be looking at my fingers.
You see, Vish and Gunshot are not fighting this thing as much as you are. So I'm
What
now
do you
worried
mean?
now.
What do you mean?
You're welcome to test the theory on me. Come, let's go after.
The Ethiopian has spoken.
They're equal. They're just equal.
These are
like-
equal.
Oh, he's an
They're
equal.
equal.
Sure,
Tell
sure.
us.
Yes, maybe
So
you
his
can. Maybe you can
testosterone
do your
and
own
his penis
study.
length are just in the right place.
I'm telling you.
No, but I think
balanced.
it's growth hormone. I
Guys,
honestly think
have you
growth
guys
hormone is
heard
a lot of-
about nitric oxide dumping?
What?
Jumping.
Is this
Yeah.
your last study that you?
No, it's actually not a study. So I was introduced to this concept by, I would say, an elderly gentleman in the gym. I mean, you guys know I love my gym.
Of course.
And we were just talking about the clinic, actually. You know,
Oh,
he was asking
okay.
what I do, and I was telling him about the clinic.
Uh-huh.
And then he asked me, "What's my take on nitric oxide dump?" I was like, "Dump? What am I got shit in
Nitric oxide
What is it?
dumping.
Yeah. So basically, nitric oxide dumping was found by some guy. Yeah, I think he's a doctor in the US or a chiropractor who's a doctor.
Yeah.
But
Oh,
basically,
doctor.
what it means is that you stimulate your natural production of nitric oxide production. So your natural nitric oxide production with high intensity exercise over a certain period of time, and that would equate to better sexual performance. And so he's saying that instead of using the Viagra's, and because he says he's done it all, he's tried it, everything, right? and he just felt like he was just in a cycle. He felt like he was a druggie. He was using all these different things. He doesn't know what works and what doesn't. But ever since he was introduced to this concept of nitric oxide dumping, his life has changed. So then I said, Norman, take me on a ride. You know, I need to learn about these things. I could probably use it myself. Who knows? One day. So basically, there's different techniques they use. This is not evidence based. There's nothing to support what I'm saying. It's just, I mean, obviously things that are there and
Anecdotal,
yeah, anecdotal. You know, you can try it, you cannot try it.
Yeah.
I honestly
work
genuinely
for you,
just
might
think it's
not work for you.
It's just psychological.
Okay, tell
Yeah.
us.
So what he does is that he says you train every alternate day. So Monday, Wednesday, Friday.
Oh, so now we're tapping into what Nas believes here.
Yeah. And you do your high intensity sessions. So squats is part of the exercise routine, burpees, jumping jacks, all this stuff. So he showed me the different exercises. And in all of that, there's a breathing routine that you need to do or follow.
In
Right?
between these exercises.
Yeah, as in, yeah. So whenever you take a break, you sit down on the floor and then you take deep breaths that last a couple of seconds. So it's basically as deep as much oxygen as you can possibly take, right? And then you do this for about 2 minutes and then you do the next exercise like that. And he says after 6 months, this guy's sexual performance was as good as being on Cialis or
What?
whatever. I was like, huh? But I just thought to myself, you know what? This guy is probably in his 70s. I mean, whatever he believes is fine. I'm sure his wife is
He's
actually
looking
still
for-
happy.
Well, I
that
mean,
he's still around.
okay, but I mean, a guy who's 70 who's tried everything and then
Yeah.
goes and tries this
Yeah.
this cheap regimen, very cheap
But,
regimen.
but think about how it could work, because any high intensity training increases testosterone.
Exactly.
Oh, there we go.
Yeah,
There
yeah.
we
Where's
go.
the where's the breathing thing now?
I love high intensity training. That is the
HIIT.
best hit. It's the best
HIIT,
thing.
right?
Yeah.
HIIT. Guys, I done one session of HIIT. Yo,
It's a lot.
it's
yeah.
a lot.
But I mean,
afterwards, I felt like I could
revitalized. Yeah,
revitalize.
I mean, there are studies that show that it also increases your natural testosterone production.
So yeah, it could be that. But then what's
so-
the idea behind the nitric oxide dumping?
I just think it's someone selling a certain product, and,
Yeah.
and he's termed it nitric oxide dump. Because when I asked him, what's the dump? Why don't you just say nitric oxide release
Stimulation.
or stimulation program? So how he explained it is, it's like you're dumping into a bag this nitric oxide. That's why they're saying there's a duration to it. So it's nothing that it's not something that you can do once off and then you're fine.
But
So
any
you
exercise
need to-
also causes vasodilation.
yes,
So
yeah. So
No,
you're
that's-
storing this nitric oxide over a certain period of time, and then you sort of reward.
by doing that breathing exercise, you
what?
release it
You know what,
with,
Nkunqa?
Yes.
I
together
think
with
that
the hit.
I mean, we did plan this, but I think we should take it more seriously. Is that we or you personally under the Gentleman's Clinic make a evidence-based training program or diet program or whatever.
Yeah, to lift testosterone.
And I mean, I don't mind.
clearly worked for you.
I'll actually be guinea pig, because I have my own aspirations to be you one day when I grow
What
up.
do you mean? What do you say?
So
Yeah,
I don't
yeah,
mind
yeah.
being. I'll actually
So
be.
you want to be told
I'll be
black
like
and
pilot.
handsome?
I'll be the pilot of it. You know, if the Gentleman's Clinic comes up with an evidence-based program, I'll be the pilot of it, and we'll even do
Yeah,
like before
sure.
and afters and
Nah,
progress.
I'll show you some
maybe,
nitric
I mean-
oxide dumping.
I mean, I'm not gonna be dumping it. But yeah, maybe we can even work.
No,
on
I think that is something we're working on, especially part of our weight loss management consultations online. Nhlantla, we had discussed that we're going to start including diet regimens, exercise
Yeah,
regimens,
it's very important.
with relevant medication that may help people with specific
yeah.
conditions like hypothyroidism, diabetes. In conjunction, we want to try and include that and make it a holistic program. So it's not just a 1 month fad and you get over it. We
Yeah.
want you to follow up with us month after month, year after year, track your progress
Yeah.
and ensure that you're living a long lasting, healthy lifestyle that's not just to lose weight, but also to increase your testosterone
Yeah.
and to improve your sexual performance, which is what we're all about. But before we end off, we've got just a few topics to discuss that our audience has actually suggested.
Yes.
And one of the big topics that a lot of young men, and I suppose not only young men, but as these young men have gotten older, they are worried about the effect that pornography has had on their sexual function. So I thought I'll leave the question open to the table and we can all share our views on what we think. Nas, what's your take on pornography in relation to sexual performance, erectile dysfunction, and premature ejaculation?
So, like, I remember growing up, a lot of people used to tell us, uh, you should ejaculate often. If you remember hearing that, they say
For
that
prostate health and
yeah,
stuff.
for prostate health, there is like epidemiological studies that show that there's a correlation between multiple ejaculations and prostate health, right? Okay, but like there is a price to it. It's if pornography affects your expectations for sex, right? The things you see are not normal, right? So if your expectations change, then when you're in reality, and the reality doesn't match, you end up having these issues, right? So like I feel it's like that's why we get a lot of psychogenic ED in young people. Mainly,
Just
I think,
explain what
because of that.
psychogenic ED is for the people.
So erectile dysfunction is, you can group it up into organic and non-organic, right? So organic would be there's some biological cause. So most common we see is diabetes actually. So if there's microvascular changes, if the blood if there's not enough blood going to the penis, right? But non-organic would be other things like you have like Brendan was saying, you have interpersonal issues with your partner. Now you had a fight and now you can't get an erection because you have that thing that you're thinking about, or there's some kind of infidelity and then you're thinking about that while you're trying to have, you know what I mean? There's all these other issues.
Yeah.
So psychogenic would be mental causes or other causes that are not organic, right? Yeah, and that's what we usually see, and that's what we're starting to see a lot currently.
Yeah.
And I mean, now porn is so freely available. And a lot of old bullies will tell you, like, back in their day, I mean, we must be honest, right? We're all men here, and majority of the people that are watching this are men. So we've been exposed to pornography throughout our lives. Our fathers, our grandfathers.
At school.
But remember, our grandfathers or fathers had one magazine that they all shared, and each one of them saw that magazine once a month.
Yeah.
And it was an exciting one time in a month, versus us who've, from the time we're teenagers, had access to pornography in our pockets.
Exactly.
On phones.
At any time, any place, anywhere, for free.
And I think it's worse because I remember the first time I was exposed was in grade 8 with the magazine, right? But obviously by the time I was in matric, it was on phones everywhere. So
Yeah.
imagine kids now. I mean, I
That are on
believe
their
Twitter
phones
doesn't have
all the time.
censorship. Twitter or X doesn't.
I'm telling
mean,
you,
it's-
You don't even need Twitter. Dude, it's
see.
everywhere.
I
So-
think one very important thing to remember just about society and the world, and Nas was talking about it, about his big conspiracy about how testosterone is being lowered and all of that. But when something is being sold to you for free, you are the product.
Yeah.
Yes.
Yeah.
You are the product.
Don't forget.
That's what you need
Don't
to know.
forget.
So
Don't forget.
I think it, and this is just all anecdotal. There's no studies here, but I definitely think that pornography does alter your neurotransmitters in the brain. I've
Like you can literally get a zinc deficiency from
So
recurrent ejaculation.
and also talk a little bit about the dopamine. Nas,
wait, can I
dopamine,
bring this out because I think this is important. A lot of studies say there's no issues with porn. Now, that's why I want us to discuss it, because everything that we've mentioned here actually is very relevant. And like we were talking about earlier, you can make a study and make rats' vaginas be
yeah,
more
of course.
lubricant from-
Yeah.
Rats' vaginas.
right? And if you studies that look at porn, they're not on the ground. They're not picking up people who are on the ground who are suffering with these issues. The same way people use alcohol responsibly, and a large majority don't use alcohol responsibly,
Yeah.
is the same, I would say, with porn, right? Because studies will pick up that many relationships are healthy when they watch porn. Okay, a study will say that a couple can watch porn together and have a great sex life because they pick up things there, it stimulates them in that way, and they have this great bond around that.
Yeah.
Or a man can watch porn, run to his partner, and perform greatly, right? And that can be the side because they are those who drink responsibly. I understand.
Yeah. If we use that same.
If we use
yeah?
that same analogy. But I worry about the vast majority who either exposed to it very young, because you smoke weed from the age of 12, you are double. I'm not a psychiatrist, but I know that it's a very high chance of becoming psychotic later on, the younger you start. When are children starting with porn? Do they do studies on porn exposure from a young age? I don't know. But what are the outcomes of that?
Yeah.
How many people, there's a type of erectile dysfunction, just forgot the term of it, where people who masturbate too much, they have a certain grip on their penis when they masturbate. And when they go to a lady, they
Yeah.
don't have that grip inside the vagina. And so they get erectile dysfunction. Okay.
Oh.
That's a known thing. So you want to tell me that these studies are all telling? I wish I had these professors, whoever's doing these studies in front of me, to say
Just
that
to question-
just to
question some
question
of the
them, to
stuff
say
that they're
that
doing,
when
yeah.
there's all these issues that porn brings up, you know, you can get a man who watches porn, when he goes to his woman, he can't perform.
Because he also gets the idea. He becomes like voyeurism.
Yeah.
So he
Exactly.
he
Yeah, you can
prefers
only
to
get
s-
aroused
yeah.
by watching other people have sex.
Yeah.
Another thing about which, I mean, it goes back to what Suel was saying, that if you are not being sold something, then you're the
You are
product.
the product.
See?
Yes.
So you might find that people who are actually doing these studies
Yes.
are being funded
yeah.
to do the
Exactly.
studies.
100%. But Nas, quickly, just tell us a little bit about the dopamine issues that people have with pornography. So, as far as I understand, you get a massive dopamine surge by watching porn. They've looked at the activity in the brain, the centers in the brain that produce dopamine, or have
Yeah.
massive dopamine surges. And when you watch porn, it gives you this massive dopamine surge. There's a lot of research currently being done by
Oh.
neurologists and neuroscientists about how to regulate your dopamine levels. And when you're constantly being exposed to dopamine, so dopamine is an interesting
Dopamine is like your reward system.
yeah, it's your
So
reward
is
system.
that what we call-
And so people that are able to only achieve something and then get that reward or pleasure
Yeah.
from it. So, for example, Nkunqa, you spend months training for one moment where you step on stage and you're there. That dopamine that you experience there is probably like no other dopamine that you can receive
Yeah,
from
exactly.
Yes.
in some instant gratification,
Yes.
like porn or whatever. But now, if you're constantly exposing yourself to instant gratification, so whether
Yes.
it be fast food, junk food that gives you that quick rush, like sugar gives you that quick dopamine rush, porn which gives you that
Quick
instant,
rush.
like,
Yes.
flood of
surge, yeah.
dopamine to your brain,
Yeah.
you become dopamine depleted. You cannot even experience joy
Joy.
during sex.
You don't have
Oh,
that
yeah.
gratification, that reward that you've worked hard for something. They call it mental masturbation.
Yes.
I think mental masturbation, where everything is quick gratification. You look at your phone, you want shorts. People can't even watch a short for 5 seconds. They couldn't watch a video for 30
Yeah.
minutes. So YouTube made shorts. Now they can't even watch shorts that are 30 seconds.
Now it's
You understand? It's all mental masturbation. Is
Yeah.
So porn gives you that dopamine rush. And now you can't even go out and talk to a woman in the street because there's no
Yeah.
drive. There's no drive.
there's really nothing.
Why? Because you can get it right here at
You
your
can get it at
fingertips.
your fingertips. Yeah. So you are the product. Don't forget that.
And so I think that in closing, I think that takes us back to what we were talking about. There's a lot of societal changes in our neurotransmission, how we perceive ourselves, how we perceive society, and how I believe, and I think there is some truth in what Nas is saying, in how society is actually altering our brains, and we need to be very cognizant of that. And if you start seeing problems, you need to get help. And that brings us to our final topic before we wrap up, and it's something very important. This month is Mental Health Awareness Month.
Yeah.
And I think it's very important for us to quickly touch on a little bit about men's mental health, which oftentimes gets swept under the rug. And that's not to say that all the other issues that women experience, gender-based violence, etc., that generally takes the forefront. But there's a definite need for us as medical practitioners and society as a whole to look at men's mental health as a rising problem.
Yeah.
Currently, the suicide rates in the world are higher for men than women.
and the violence of how these suicides are being committed
Yeah.
is also
Yeah.
higher in men.
Yeah, men get the job done. That's just a guy will shoot himself in the head. Will if he's upset, if he's depressed, if he can't feel. And I think I want to just open the table up for us to just quickly discuss a few things that we think might be contributing to men's decrease in men's mental health. Vish, you want to share anything?
So, yeah, just with what you said, it is, I mean, the stats do show. So, more higher parasuicide attempts obviously are by females, but
So
the
parasuicide
higher
is
percentage of,
just so that
of
people
obviously,
understand.
so yeah, so parasuicide is a suicide attempt. And then the rates are obviously now, as you mentioned, higher in terms of actual suicide rates, which are men. So, a lot more females obviously planning or attempting suicide versus a larger number of men who actually end up doing it.
Yeah, sorry to
So-
cut you quickly. Working in ED, I experienced this a lot. In my experience, and I'm sure there might be studies to back this up, but women generally do it. A lot of these parasuicide attempts are to gain attention or as a cry for help from people around them. Whereas when men do it, they want to die. There's no, I don't want help. I don't think I need help. I
Yeah.
know that the solution to this problem is for me to die. And so that's what I'm commonly seeing. But continue. Yeah.
Yeah, so I think even in this day and age, I think certain stigma to be a certain way, have certain amount of money, drive certain cars, live in a certain area,
Yeah.
live a certain lifestyle.
Urban, yeah, living in an urban city, yeah, that's
Going on vacations every month, second month, to fancy destinations. I think a lot of these things are like obviously social media,
definitely.
what it portrays. Obviously, I mean, if you aren't able to be that way or live that certain lifestyle, I think a lot of that takes a toll on
men.
Yeah.
And I think it's a complete, what people don't realize, social media definitely perpetuates that idea. When you talk about the mental masturbation, people are busy sitting there scrolling. And all that this algorithm is feeding you is, I want to show you a life you don't have. I want to show you something that is right now unattainable for you. So you see someone on a holiday, on a yacht, and it's right here.
Yeah.
And you're stuck on call with 10 patients. Some guy just shot his penis. You automatically go, my life sucks. This guy's life is so amazing.
Yeah.
But he's not showing you all the other struggles or whatever that he had to go through to get onto that yacht or to go on that holiday. But all
Exactly.
you constantly are fed is that's the life, that's the life, that's the life. And it I think perpetuates this idea that you're just not good enough.
Yeah. And I mean, as men, I think, I mean, we all know this. Society demands a lot from us. We're the providers. We're the ones that, tend to be expected to take our women on trips and holidays and
Yeah.
provide the homes and cars, etc.
And for your children
saying
and
women, when
for-
we're saying men, yes, for your children, yeah. I mean, we're not trying to downplay that, females don't have
Depression
mental-
and
it's
stuff,
there. I mean, it's
Yeah.
probably even worse, But we're just obviously trying to highlight the fact that with men, it's very intentional, it's very violent. And, when someone is at a stage of thinking of committing suicide, chances are they'll pull through with the plans. So it's very important that we take this very seriously, and we have platforms like this where guys come
Yeah.
together and we talk, so I'm blessed to have people like you guys around and can always, open up and
No, I mean,
get
and
told.
the thing is, like, I even, not too long ago, I almost like a consultation went to Brendan, and I was like, hey, I'm going through a difficult time. I need some advice. I need some help. And it's, I mean, it is, even for me to reach out to my friend, it's difficult. Because you're told in society as a man, just shut up and go and work.
Exactly.
Shut
Yeah.
up and go and work. And if you're going through a difficult time, it doesn't matter because, who cares about how you feel? It doesn't matter about how you feel.
Yeah, other men
Just-
are out there working.
To some extent, I do believe like men are a little bit more stoic. And, we push on through a lot more. and society has expected us to do that. But I also feel like as the years go on and on and on, you've got to admit to yourself, hey, there's times where I can't function, I
it's
can't
normal,
cope, and I need help. And it's very difficult for us to go and seek that help.
Guys,
But there's platforms.
you know, there's a colleague of mine a few weeks ago said something during a talk. We were talking in general, and she said, in this country, men are only allowed to have two emotions: happiness and anger. That's sat with me ever since, because we this country. I'm not talking about westernized societies. I'm talking about us. Men are told, you know, indoda ayikhali, you know, and that's what we grow up believing. A man doesn't cry. A man is resilient. A man provides, you know, and you push that for yourself because you want to succeed personally and you want to succeed for your family,
Yeah.
you know. But when you have a family and you are not succeeding and life is just against you, you've fallen into habits, perhaps you have no one to talk to, you know. And I'm going to ask that ladies also realize this more about their men, is that men don't know how to talk. And a very, very painful thing that men experience is that you'll find that there's that one time a man decides he's going to talk his heart out, you know, and he does talk. And then some way, if it's not immediately or later on, that deep thing that he told you that has been keeping, has been eating him,
Yeah.
you use it against him. That can drive men to a lot of unspeakable things.
Yeah.
So it's really, I mean, suicide has affected me and my family, you know, closely. So it's a sensitive. Even now, my heart is racing. I didn't think I'd be able to get this out while you guys were talking that side. But yeah, that's all I'll say. And I'll ask that we perhaps have a podcast, like almost an episode solely on this topic. You know,
And even get a
soon.
psychologist or
Yeah,
someone,
true.
like an expert in.
And someone. So yeah.
Nas, anything you want to say on this topic before we wrap?
Yeah. Just on in terms of how to reach us and
No, I mean just on
And
this,
just
and then
that-
before we
yeah.
close.
So I think
on this
the phrase people use a lot is "be a man." You know that one. So it's like I want to make it positive. So when someone says "be a man," they mean that all your problems are in your hands to fix, and you have the ability to fix it. That's all I want to say.
yeah.
So yeah, let's be also sensitive to each other as men. You know, I'm very, like you said, I'm grateful that I have you guys here as well as my friends. Besides colleagues and business partners as well, but we also need to lean on each other as men.
Yeah.
I mean, it's
And
not
normalize it,
weak
you know?
because we understand each other better, and we won't use things against each other. You know, because once you use something against a man which is gotten off his chest, he will never tell you another thing again, and he'll let things fester until he puts that gun to his head.
Yeah.
So let's look after ourselves. Let's look after each other. Ladies, let's look after your man, and men, let's look after our ladies as well. But let's reach an understanding. You know, I always say that you don't fight each other, but you fight the problem. So yeah, I'll leave it at that.
Yeah, look, great episode, guys. Just in closing, we have one issue that we're experiencing on our website, and a lot of people have difficulty figuring out our booking process. So Nasim is going to walk us through how to make a booking and complete the payment in order to consult with one of these lovely doctors here today. So Nasim, you want to look dead into that camera and tell us exactly how you make a booking and how you make payment so that you can see one of us.
Okay, so go to gentsclinic.co.za. On the top page, you're going to see a drop-down menu which shows all the services that we offer. And then you're going to click any of those services.
The service that is
The
appropriate.
service that you want to do, that you came for. Then scroll down on the page and you're going to see a lot of questions that are on there. This is a free assessment, right? So you're going to click the questions, answer the questions, give us some your email address so we can send you back a response on what we see on those questions. The questionnaire is not an assessment, it is not a consultation. You can only get a proper consultation with us after you've finished booking. Then you're going to see a doctor virtually online. It is all completely online. There is no physical practice. So it's all very convenient. You're going to book online and you're going to see, after you finish the questionnaire, there'll be a thank you page, which will take you down to the booking process. There's going to be a calendar where you can book and choose a date. So you're going to choose a date, then it takes you onto the payment page. Then you pay. If you have medical aid, you can claim back from the medical aid with an invoice that we can send you. So after you've made a booking, we're going to send you a link so that you can click that link at the time of the consultation so that one of us can talk to you and go through all the problems specifically for you. If you need a prescription can be sent to you, and you can take that prescription to your nearest pharmacy, or we can send the prescription to the pharmacy. And that's it.
I think that covers everything. Thank you for joining us for another episode of the Gentleman's Clinic podcast. My name is Sohail Essa.
Dr. Nkunqa Vilagazi.
Dr. Vishen Naidu.
Dr. Brendan Matthews.
Dr. Naseem Sharif.
And we will see you next month.